Today on Dueling Doctors, the So Annoying Show, we'll discuss 3 very irritating ailments many of us have experienced at one point or another in our lives: seasonal allergies, psoriasis, and warts. So what causes these aggravating issues and how can we treat them properly? Doctors from the worlds of holistic natural and conventional Western medicine square off on how to end these frustrating conditions once and for all. It's holistic and natural versus conventional health experts with different opinions and one goal: to help you live a healthier life. Dueling Doctors. Hi everyone, I'm Dr. Frank Spinelli. Each week on Dueling Doctors, experts from the worlds of both conventional Western and natural holistic medicine join us to debate and discuss the best ways to treat common conditions. Let's get started by introducing our guests. Joining me on the Western Front is Medical Director of Allergy and Asthma Care of New York, Dr. Clifford Bassett. And on the holistic side is board-certified acupuncturist and herbalist Mary Sabo. Welcome, both of you.
Thank you.
The first annoying ailment we're talking about is allergies. Spring means warm weather, blooming flowers, but for millions of people with seasonal allergy, it means sneezing, congestion, and a runny nose. Seasonal allergies, also called hay fever or allergic rhinitis, can make you miserable. Common allergens are pollen and mold spores in the air, and when they're inhaled, they cause an immune response. Now we know what causes it. How do we alleviate it? Each of our experts has up to 1 minute to present a treatment plan, and then the other will be given a chance to respond. We flipped a coin before the show to see who goes first. And Dr. Bassett, let's talk about allergies.
Great.
What is your approach?
Well, we're in the middle of an allergy epidemic, pollen explosion, climate change, a lot of suffering, and people need to be on allergy alert. Warm winter, wet winter, pollens are primed, ready to go in those trees, and people coming in for the very first time, 60, 70, 80 years old, never had it before, they're suffering this year. And it's all about taking the time to do prevention and being proactive, trying to prevent symptoms before they occur.
Okay, so what are you talking about when you mean prevention? What do we do?
Simple things, first of all. Taking a vacation by a body of water, pollen counts are lower, not practical for everyone. Sunglasses, a hat, no hair gel. Pollen sticks to your hair, you go to the bed at night, transfer to your bed sheets, you wake up feeling red, eyes irritated, pollen's getting there.
So
you want to do
sunglasses when you go outside.
Correct.
No hair gel.
No hair gel, hats, and also
hats.
Nasal saline, neti pots, simple little bottles you can buy, dislodge the pollen, dilute the pollen. And finally, foods. Guess what? It's not just the pollen that gets into your nose, it's also the foods you eat. 70% of people with seasonal allergies who have oral allergy syndrome, their allergies get worse from fresh fruits such as apple, pear, cherry, stone fruits, can aggravate their allergies and cause an allergy attack.
But why is that? What's the mechanism?
There's a cross-reaction between the protein that's in fresh fruits, vegetables, spices, and nuts with the pollen. So your body thinks you're eating pollen.
I thought fresh fruits and vegetables would be good for you if you had allergies.
It is, but many people who have seasonal allergies get worse when they have certain fresh fruits because the proteins, the profilins, cross-react with the pollens and actually causes an allergy attack.
So what do you do if I come in and I say I'm not doing the hair gel and I'll wear the glasses? What kind of medication would you prescribe for me?
The best long-term treatment I could do is fix the immune system with immunotherapy or allergy injections.
Okay, allergy injections.
Allergy injections.
You go straight for the injections.
I'm giving you the best possibility.
Okay, give me the best.
90 to 95% effective cure rate. In other words, what I'm saying is they can reduce symptoms for many years. Put the time in, like at the gym. You got to put the time in for a few months and years. Get the immune system working for you.
But first, you would have to do allergy testing to see what you were allergic to.
That's
and you differentiate food versus respiratory allergies.
Absolutely.
Right? And then you would go for injections.
I would say if you're a sufferer and you've been through medications and you want to avoid nasal sprays and steroids and so forth.
Okay, so how many injections do I need?
Well, usually an injection for pollen, an injection for indoor things, and maybe pets.
And so it's once a week. I come in, once, and then it's done over for the season?
Once a week for several months, and then we build up to once a month for a couple years.
Okay, so I don't want to get rid of my hair gel, and I don't want to do the shots. What's left for me?
Now we're talking about the real world. We're talking about over-the-counter remedies. We're talking about medications, neti pots, saline. We're talking about oral antihistamines.
Like Claritin,
Allegra, and so
all that
forth.
Stuff that's over-the-counter.
Look for non-sedating and make sure there's no interactions with medications you might be taking. No.
Really? Which
the non-sedating are strictly non-sedating, and the FAA lets pilots take non-sedating antihistamines.
So which one is that? Because I just
Claritin, Allegra, non-sedating.
There is a non-sedating form, or are they?
They are non-sedating.
They are.
They are low sedating, and there are other things like oral antihistamines that are sedating. Read the label and really be a label detective. It's very important.
I am pretty much I'm like the Angela Lansbury of labels.
Excellent.
And I have to say, it says drowsiness, and I've taken Allegra and Claritin. It makes me a little drowsy, and I don't like taking the D, which is the decongestant. or anything like Sudafed because it makes me like I'm crawling out of my skin.
Right. The decongestants are not ideal for long-term use. They may be fine if you're going on a plane, you have a cold, but they do raise blood pressure, increase your risk of other problems.
I do like one thing, and I call it eye candy, which is Patanol eye drops. I think those are a miracle drug. They relieve that itchy, watery
So you want
eyes.
to combine this with an oral antihistamine, a nasal antihistamine, and a nasal steroid. Now, the most vexing
nasal
symptom
steroids
are...
I'm very nervous about nasal steroids because I think people abuse them too much.
Well, I could say this. The nasal steroids are safe. They've been around for decades. They're quite safe. They're topical.
Yeah,
they're not the same as anabolic
cocaine and
steroids.
marijuana, and people are addicted to it.
They
I'm just
work
saying,
well,
like,
and they're
but
topical.
when you take a nasal steroid, can't you get rebound, congestion if you don't? Really?
You get rebound from something like a nasal decongestant.
Okay.
And that's important to understand. 3 to 5 days of overusing a nasal decongestant, you're going to get rebound. Nasal antihistamines and nasal steroids work well on one symptom, particularly nasal congestion or stuffiness. And it's the #1 symptom that drive our patients crazy. Put it together with eye drops, like you said, the Pataday, Singulair, and you have a variety of approaches that we can do both prescription or over the counter to pre-treat and get your allergies under control.
I want to hear from Mary because he assaulted me with drugs right there, and my hair too.
Well,
so.
I think I actually am really happy about how he started with the injections and the doing
so you
some
believe in immunotherapy?
smoothing. You know, I am an acupuncturist and I like using acupuncture and herbal medicine.
Yeah, but you're talking about a different needle. He's
of
giving
course,
you a needle with injection.
I know, but
You're giving me a
it's not
therapeutic
just
needle.
shoving drugs on people.
Okay, so
you know, there's
what's
a little bit of building up a
talk to me
tolerance,
about
right?
acupuncture.
That's the whole point of using the injection is to build up a tolerance.
Correct.
Yeah.
You got it. That's
okay.
exactly what it's
so with
about.
acupuncture, actually, we're working to calm the immune system, and I'm using points that we now in studies can see that there's an effect on the antibodies and the immune
Where
system.
are these needles going?
So I'm using points behind the ears.
Behind the ears,
I'm using points locally to open up the nasal passages, maybe over the sinuses.
Okay.
I'm using points to help digestion because, as you said, with these food allergies, a lot of people are ingesting allergens on a daily basis, and they're not even aware of it.
So what do I do if I have food allergy? Do you
Well,
recommend?
a lot of people don't know it. A lot of people come in and they're like, these allergies, I'm on Singulair, I'm on Advair, I'm on an inhaler, I'm on a
Okay, so you named a lot of Singulair.
Yeah, so people come in and they're on all these medications and they're still miserable.
Right.
And so I start to look for places where they're still getting exposure and they're not, because we're all about limiting exposure. And then with the herbs and the acupuncture, I'm regulating the immune system.
So what herbs in particular?
So I like a formula called Jade Windscreen. It's a formula that you can get online, Jade Windscreen.
Okay.
And it just helps to regulate the immune system. It's also actually good for preventing colds. It kind of boosts the side of the immune system that helps us fight infection.
You know what I like? When I go to my barber and he puts that hot towel, there's eucalyptus in there.
Yes,
and I feel so good right there. My nasal passages open, and I could lay there and go to sleep.
So you can use eucalyptus oil in the shower. I tell my patients just
so
a
what
drop
about
or two
this?
in the.
This is a neti pot.
Okay, so this is a neti pot. This is a very nice one, actually.
Thank you. It's
and it's a little bit of an uncomfortable sometimes treatment, but it's very effective. And what
how
it
does
does,
it work?
it cleans out the sinuses.
So you pour water in
you pour
here?
warm saline water.
Warm
You have to make a
saline water.
saline solution, or you can buy it at the store.
And then you stick it in your nose, and you tip your head like this.
You tip your head over the sink.
And it flushes out the other end.
It flows in one nostril and out the other.
Yeah, I'm not doing that, but.
It's actually really nice. And then you blow your nose, and all this phlegm comes out.
Okay, another question for both of you. Do you blow your noses or do you dab them?
Blow.
You blow your nose? What about you, doctor?
Just too gentle.
Yeah.
I'm just a light dabber. I'm sorry.
Okay.
That was a lot of great information. We have to take a break. Coming up next, we're tackling the most common autoimmune disease in the United States, psoriasis. Don't go away. Welcome back to Dueling Doctors, the show where health experts from the worlds of conventional Western and holistic medicine debate the best ways to treat the ailments that affect us all. Today's topic, annoying ailments. We're joined by Western physician Dr. Clifford Bassett, as well as our natural expert, acupuncturist, and herbalist Mary Sabo. Now we're moving on to psoriasis, a condition that affects more than 7 million Americans. Psoriasis is a chronic autoimmune disease. It affects the skin, and it occurs when the immune system sends out signals to speed up the growth cycle of skin cells. Most common form appear as raised red patches with a silvery plaque. Each of our doctors has up to 1 minute to present a treatment plan. Dr. Bassett, you went first, so we're going to kick it over to you, Dr. Sabo.
Sure. So in Chinese medicine, we see psoriasis as heat and dampness on the skin. And you can see it in the redness in the skin. And oftentimes, I like to work with people's diet. I think there's often a dietary element to this. And so I'll have people experiment, especially with eliminating nightshade vegetables, which sounds really bizarre.
I know, I love it.
Yeah,
I love it.
Yeah. So nightshade vegetables
give us some
are
examples.
eggplants, peppers, tomatoes, and potatoes.
All the things my mother loved to cook.
Of course, as an Italian. I know.
We can't eat them if you have psoriasis.
Yeah, so I have them eliminate that, and if it doesn't do that for 2 weeks, I have them eliminate, and if they don't see improvement, I have them start to experiment with gluten or dairy.
So you really feel like there is an allergic
there's a big
component.
link to the gut, to the digestive system.
So eliminating certain foods.
Yes, and then I start to build up the gut with herbal medicine and acupuncture.
Okay, so give us some examples
there's
of
a really nice
medicine.
herbal formula called Skin Balance. It's from a company called Health Concerns, and I think you can probably find it online.
Okay, so but what would be in it, so we knew in case we wanted to buy
there are some
individual
herbs
ingredients?
that help regulate the immune system, just like we saw in allergies. And then there are herbs that calm inflammation, which we would see as clearing heat, and then eliminating dampness, which is another way of kind of saying regulating the immune system.
All right, and now what
then,
about doing something topically?
Yes, topically. So we see psoriasis as both an internal and an external disorder. So we would never treat it just externally with some sort of cream. And when I have patients come in that are on creams, they might notice that their psoriasis goes away, but we see that as just suppressing the symptom.
Yeah, but you want to do that in conjunction
Right,
with taking
so we'll
something
do an
orally.
internal formula. I'll do the acupuncture to help regulate the immune system and calm inflammation. And then I'll do a topical, I like an oil called Tamu oil, which is from the same company, Health Concerns.
Right.
And it has tamanu oil, avocado, and peppermint.
Peppermint?
Peppermint.
Now what about using aloe vera? Would that
Aloe
be
vera is
helpful?
good, yeah.
And I've also heard about using capsaicin.
I don't actually, I'm not
you
as
don't like
familiar
it?
with that, no. But I
Okay.
actually have had some patients have success with just coconut oil, like
Just
a high-grade
coconut oil.
coconut oil. It's very moistening.
And would you also recommend using a light box ever?
Yes,
Oh,
light box
really?
is great.
And that
It's
exposes you to
UVB therapy.
UVB
Yeah, it's
therapy.
very controlled exposure. A lot of psoriasis patients notice improvement in sunlight. And sometimes vitamin D supplementation is helpful as well. If
But really, when you're talking about acupuncture, it's really for stress reduction as well.
Stress reduction is a really broad
I know,
statement.
but when you're in acupuncture, how long is the session about?
It's about half an hour with the needles
that's-
in. So people are taking a nap with the needles in.
Theoretically, it's a relaxing time.
So I explain
I would hope.
acupuncture as communicating with the body. So I think of it as pushing buttons on the body. So we're using specific points. So
Right.
with psoriasis, I'm going to use points at the elbow to release heat, and at the knee to release some heat, and the inside of the knee to drain dampness.
All
so
right.
I'm actually using specific points to tell the body to do something different.
All right, Dr. Bassett, she's releasing heat over here on my
Also,
body to get rid of my
tobacco,
psoriasis.
cigarette smoke, and stress
Yeah.
can actually
Are you
aggravate
amazed
psoriasis
that people
as well.
still smoke?
It's
As an
uncanny how
allergist-
many young people smoke.
I know. You
it's
know, my
amazing.
favorite is people in like
Oh my
Lululemon
God.
smoking.
Yeah.
And patients I
and,
have
like,
with
workout
asthma
gear.
smoke, and they're afraid to tell me, but it's very evident when they come in, they've been smoking.
So definitely asthma is an exacerbator of psoriasis. So what else would you review in a patient's history that they have it?
Well, the family history. Let's make sure it's not another condition. Skin cancer, other things, infections. You want to make sure you're treating the right thing. And I rely on my experts, the dermatologists.
Sure.
When people have psoriasis, they're embarrassed, they feel uncomfortable, they're itchy. They want to get the job done efficiently. And as an allergist, I'll work with a dermatologist that's an expert in psoriasis that provides a whole variety of different approaches that are effective. And even in severe psoriasis, the treatment's usually pretty effective. They may need to do light therapy, they may need to do cream plus light therapy. It will get the job done, but unfortunately not a cure, a treatment that makes people feel better and feel more comfortable.
Don't you feel like there's just so many things available that you could put on your body? You know, you have vitamin A derivative, vitamin D derivatives, you have tar. I mean, where do you go first? Because I find that if I had to pick 3 disease states that give me the most trouble, it's headaches, backaches, and psoriasis.
Really?
I mean, talk about the heartbreak of psoriasis.
Yes.
It is one of those things where I find, like, I think a lot of people just get a hydrocortisone cream. It makes them feel good a little bit. It doesn't really take away the symptoms, and then they have these acute exacerbations. So what have you used maybe as a first line?
As a
Just
first
in
line,
general.
I love
know-
moisturization. And how do we do that? When you come out of the shower, you're wet. That's when you would throw on your unfragranced moisturizers. locks it in, lasts longer. And people say, oh, I moisturize. I go, how often? Once a week. You need to do it 4 to 6 times a day or more. You want to moisturize and reduce the itchiness and reduce that irritation, the dryness you get with psoriasis, those plaques. They're unsightly. They're really, really hard to do. And you can use some over-the-counter remedies. They're not that successful. People typically wind up doing steroids, topical steroid creams. They can go from high potency to low potency, and it may be necessary when an outbreak occurs,
have you
combined
ever used
with other
tar
prescription
products?
creams. I have. I think it doesn't work as well as some of the prescription stuff. Frankly, they work better, they're more effective, and people want results today. They don't want results 6 months from now. I like light therapy, and I love UVB. It's a very, very low-risk procedure, and UVB handled correctly, it's a variety of conditions.
But very small areas. I mean, we're not talking like completely over someone's back.
But over time, and you can't give up. You can't go once or twice. You got to keep going and doing it. It's very effective, also with topical creams, and provide long-term relief. And that's what you're really looking at. Again, arthritis can be associated with psoriasis. Psoriatic arthritis, you need to see a doctor for that and get tested and find out the best way to approach it.
Okay, so moisturize, give me the heat. Good, I'm good. We're going to take a break. Coming up next, say goodbye to those worrisome warts. Welcome back to Dueling Doctors, the so annoying show. For our final topic, we're debating something we've all experienced from time to time: warts. Warts are an overgrowth of skin caused by the human papillomavirus, or HPV. It is transmitted through contact. Warts can grow anywhere on the body. They appear as rough-shaped nodules that, to me, look like little mini cauliflowers. Now you know what it is. Each of our doctors has up to 1 minute to present a treatment plan. Dr. Bassett, talk to me about some warts. How do you treat them?
Well, it's all about the location. If they're on the feet, plantar warts, flat warts. It really dictates how you treat them, and if you have a young child versus an adult or adolescent, different types of approaches.
So I got a wart on my finger, hypothetically, you know, and I come in. What would you recommend if it's a single wart on the hand?
Well, the good news is in many cases, maybe even half the cases, if you leave it alone, it may go away, particularly in mild cases. So do nothing or do no harm is the first approach. But there's a lot of home care stuff. Some of it's not that effective. You have things such as duct tape, you put on the wart, leave it on.
Yeah, I read that and I laughed. That's something like my father would do.
I don't recommend it. I like
tie a string around.
I like my patients to get results. And so you really need to go to medications, topical medications that be prescribed by dermatologists and doctors.
They have like salicylic acid and topical, and they even have home remedies. Have you ever prescribed Aldara?
I have.
For patients
but
to
I
use
really
at
like
home?
cryotherapy.
I love cryotherapy.
I love cryotherapy.
So cryotherapy is, I use liquid nitrogen. You're actually freezing warts. And the way I do it is I take one of those otoscope, the little cones, I put it over the wart, and I spray it right into there, and it just annihilates it. It's not going to go away right away.
Correct. It may
but
take
it will
a week
regress.
or so.
And I think that's a very good therapy.
Yeah,
I mean,
it's safe, it's really
else,
well tolerated, it's easy to do, and I think that's a great way to go for most people. Obviously, if you have a big problem, you need to see your doctor and talk about laser and other approaches.
And surgical removal is also an option for some people who have very bad...
Cautery and so forth, yes.
It is astounding to me that people walk around barefoot, because I think plantar warts also are very, very hard to treat, very difficult.
And a lot of kids will come in with warts on their face. Look at their hands. They're touching their face. They're passing it along.
They're passing it along. Okay, so what do you got for us on the natural side?
Well, I think it's important to remind patients that it is contagious. So they do want to kind of cover the warts, especially plantar warts. I tell my patients to wear shower shoes. But acupuncture has a cool treatment. Really? We actually needle around the wart, which sounds kind of painful, but hey, you guys are freezing them off. And then we start to lift. And on top of that, when the patient goes home then, we have them do an herbal paste of antiviral herbs, put it over with some tape, and they change that every day.
What kind of antiviral herbs?
Andrographis is a great one that you can probably get at your health food store now. It's becoming very popular. It's great internally too, so we'll do also internal medicine. We'll do some antivirals, and we'll support the immune system with, again, that jade windscreen is great for supporting the immune system. So we're doing, again, internal treatment and external treatment with the acupuncture and the herbal paste.
So I think it really is important to say that these are really considered, if they're on the skin, benign, and they might go away. but specifically certain warts, all warts are
need to be
highly
removed.
contagious. And eventually,
Right.
especially if they're on the genitals, then they have to
Delicate
be
body
removed.
parts, you
Yeah.
really want to get them
Because
removed.
you're gonna
Yeah,
piss
I
I
them
like
off.
a blending. What we did today was
Yeah.
talk about the natural and some traditional therapies, and I think why not do both?
Right.
Well, I might be on the outside of this. I think cryo is the way to go. I mean,
Do you
I've been
anesthetize with cryo?
No.
No? No? You just freeze it right off?
Yeah, I mean, it feels sort of like a icy hot feeling, and then it goes away.
Okay, oh, I see.
And I think it's
Very
really
tolerated. It's
Yeah,
really
okay.
not big.
Because you
big
could
deal.
Yeah,
also-
same with the needles into the wart. People don't feel it.
If you have a
It's
young
so
child,
thin.
whatever you do, they're going to cry
Yeah.
because they're
Yeah.
upset and they're
Yeah.
scared.
Yeah, with kids,
but
I'll just
in
do the
general,
topical.
very easy treatments.
But you
safe.
can
Yeah.
also burn them off as well. I mean,
Yeah.
we have
Yeah,
a
with kids.
bifurcator, and it's an electric, and
Yeah,
you
it's
just
electrocautery, a little bit more
Electrocautery.
complicated
Yeah.
perhaps. You want to worry about getting rid of the wart, but then there's a scar. So you really want to do what Frank says.
Yeah.
Things that are very gentle and get the job done,
Yeah.
but really don't create a scar, because
Right.
sometimes that could be bigger than the wart or the problem.
Right.
Yeah, exactly. I think the best thing is, if the wart bothers you, have it seen by your doctor, because it may not be
That's
a wart,
right.
and you might want to have it biopsied
Right.
just to make sure.
Yeah.
All right,
Agreed.
we're going to take a break, but up next, it's time for viewer mail. Welcome back. We're in the home stretch of our So Annoying episode, and I want to take this time to answer a viewer question. This is from Lucy from Nutley, New Jersey. I am a 21-year-old, and I have had eczema for as long as I can remember. But in the past few years, it has gotten progressively worse. I've tried various creams and ointments, but nothing seems to help. Is there anything else I can try? Well, Lucy, eczema is a chronic inflammatory condition. My approach to patients with eczema is to first identify the allergen. Airborne allergens, chemicals, foods, and irritants found in soap and shampoo can trigger eczema. You can use an hydrocortisone cream that you can buy over the counter or aloe vera lotion to relieve the symptoms. Also, some research has reported that people with eczema have an inability to process fatty acids. I recommend taking fish oil or evening primrose. Patients taking fatty acids notice a reduction in inflammation and itchiness. And finally, Lucy, you should start taking a probiotic. This will reduce the allergic reaction by improving digestion as they help the intestinal tract absorb food allergens. So, identify the allergen, apply topical aloe vera lotion, take a fatty acid supplement along with a probiotic, and you won't have to call your doctor in the morning. I'm Dr. Frank Spinelli. Hope to see you soon on Dueling Doctors for more healthy discussion as you discover your path for your own personal prescription. And as always, please be sure to talk to your healthcare provider before making any medical decisions. We'll see you next time.